Well, good afternoon. Welcome to everybody who decided to join SanoSeminar today. Today we planned at this seminar two talks. The first talk will be the talk given by Dr. Adam Sułek, who has obtained his PhD 3 years ago.
Yeah.
3 years ago in chemistry, and other means research are devoted to apply chemistry methods in analysis of influence of different medicine on each other and on a patient. And he is also trying to use artificial intelligence in his research. And well, so it is partially close to pharmacology, if I'm not wrong, completely. And well, Adam will present this part of the seminar, which will be devoted to Nobel Prizes in chemistry. And well, we have also a plan to cover Nobel Prizes in medicine by Sabina Lichowaj. I hope that Sabina Lichowaj will be able to join us because she had some troubles with her car and is, let's say, doing all her best to get here to Sano. But anyhow, now the floor and the screen is to Adam.
Thanks for invitation and for having me. I'm a medicinal chemist by training, so I'm not sure which Nobel Prize is closer to my scientific interesting, but I will start with chemistry, which are metal-organic frameworks, this short abbreviation. It's quite promising topic, even though it was found 20 years ago. We will discuss how these promises are fulfilled in real application. These are porous material, as this topic said. But also I want to discuss the discoveries that could be a Nobel Prize, but somehow they are not awarded as a Nobel Prize. So some discoveries, in my opinion, shaped more medicine and chemistry. And from my perspective, how it come that these big discoveries cannot be awarded. So maybe will be some consideration and discussion, open discussion. First, I will introduce the Nobel Prize winner in chemistry, Susumu Kitagawa, Richard Robson, and Omar Yaki. An interesting fact is that Omar Yaki is the first Jordanian citizen who awarded Nobel Prize. Oh. And he was born in society where most people are illiterate. So this example shows that even though some circumstances are not good, if they change, then people could achieve big things. So Omar Yaki is the first Jordanian Nobel Prize winner, and here's his quote during the telephone interview. When you can control the matter on the atomic molecular level, then you can address a specific problem. And here are some problems. He mentioned that gas storage, medicine, and others, and we will go through them. So And today I will mostly focus on his.
The age of these people,
I
don't know.
checked. Probably he's the youngest model. He's before 70 years old, but others is something about 80 years old.
Oh, and they obtained the Nobel Prizes for something what they have done probably
Before.
longer.
Yeah, exactly. I was trying also check the in age index, and all of them are in the normal distribution with quite high, like almost 70 age index. I heard about MOFs when I started my study during the inaugural lecture during my chemistry study, so it was a long time ago. And professor said that 1 gram of some specific materials could have a surface area of few thousand of meters. So I was surprised, but everyone around me was nodding in agreement that it's obvious. But I hope this example shows that it is obvious. So it's a small experiment of thought that we have 1 cubic meter of space and we can divide it into slices like this square sheet. So let's say 1/10 in height. So we have 10 sheets, and each one sheet has a quite big surface. And we can easily calculate that slicing this 1 cubic meter of space gives us much more surface area. Another experiment of thought is that we can curve out the sphere inside this cube, and we end up with sum of the area of the sphere and inside this figure, and outside of this figure we still keep the surface of the cube. So effectively it's add up. And some materials with high surface area. So we can easily imagine that this kind of caveats inside this cube could be in big amounts. So we have effectively a really big surface area. And one example is washing powder. So I was thinking still that MOFs are in washing powder, but zeolites are in washing powder because they have this like a sponge shape, but this designed in this Nobel Prize MOFs are of course much more expensive, so they are not in washing powder. I will start with example from my domain, how some chemical rules and can be used in designing of some molecules and ends up with some, in my case, activity, in MOF's case, some properties that we want to obtain. So usually we simplify the problem, and it's not only simplify, but usually it the reason why something is active or have some properties is specific puzzle in specific arrangement in 3D space. So we call this pharmacophore. It's not important, but the point is that if we work in this area, we want to modify somehow this final drug, and we can easily obtain something similar in one-step reaction. But if we want to obtain exactly the same thing, like from starting point, we have at least 9 reactions. Some reaction steps are like 20 or 30, so it's not that easy. So this illustration I showed you, you can think two things. Why we are matching these two puzzles, they are not exactly the same like the starting point. For example, we can start with another puzzle and you obtain something more similar to the starting point, but it doesn't work like that. We don't have all of this kind of puzzle. We only have limited numbers, and this limitation is from chemical rules. Because, for example, if you want to attach something, here or here, it's not that easy because every reaction occurs at the same time. So you have whole possibilities. So we have to somehow additional step to obtain this puzzle or building blocks at the beginning. So basically we have some puzzles in the shop. It's not exactly shop, but it's a really big company in Ukraine, and I mean, but there are also others. But we are limited in some building blocks. So on the spreadsheet, it looks quite simple that we should add this part, and maybe it will give us final product, but usually it requires a lot of steps.
Could you explain these acronyms like DCM and so on?
I mentioned them because from my perspective, RT, for example, is room temperature. So we are thinking about it, can we scale it or not? Because in room temperature, we can imagine a situation that we can apply a robotic arm, which add everything to some dwells and mix in and do a lot of stuff for us. If we use room temperature, probably for some reaction, we decrease the yield. The yield here is marked. Usually use higher temperature, higher yield, but there is a compromise because sometimes we want to automate something and we cannot hit whole infrastructure. So we are using room temperature and then we can automate. So that's why I mentioned this, because it's not just only some specific names, but our limitation how to scale things. So, and here's the question, can we shorten this? And Professor Grzybowski, he's Polish scientist, applied rule-based models. We can call this machine learning models, but usually it's rule-based, and so we are starting from available building blocks. We are trying every reaction that we have. There is not so much, but it's like 150 or 200 reaction. So some student has to put this down, put some rules, how computers will apply them. And then we are moving on this tree of possibilities, which reaction can occur and which reagent are needed. And in this way, we can choose this model are choosing the best pathway, like the last step require even some properties like prices of building blocks are included in this model. And finally, it gives us from 20 or 30 steps into less than 10. So it optimizes the process really. And this is commercially applied, Synthetia. I'm not sure the name of this company. Another company, Polish company, is Molecule One. They are using transformer models, so they're using AI to do this. And of course, if you think some more complicated reaction and big tech pharma company, then the cost, optimizing of this cost is huge. And actually, if there are more than 10 steps, in each step decreasing of 50% gives you something like you have to start with kilograms at the beginning, because at each step you are reducing by half. So sometimes it's even not feasible if you have too much steps. So this kind of solution is arguably maybe the Nobel Prize in the future. But going back to MOFs, Here's the work of Yakhi from 2003. This is the name of this this publication, reticular synthesis. Reticular means that porous material. And on the beginning, they said in the abstract that long run challenge in chemistry in building the molecular materials with building block is already seems to be solved. This is a bold statement, but the demonstration of their work actually fulfill this statement. So for simplicity, we can start with this octaeder, and this is the first thing of this achievement of this approach. We have nodes, this green one. The shape of the nodes, like here, gives you the direction of connection between the next arrangement. So in this octaeder is quite simple. Each connection has is like along axis X, Y, and Z. Second thing is linkers. Here on the bottom, there are different linkers with different length. So length of the linkers define the cavity range. And third thing is chemical character. So different X inside these linkers gives more hydrophobic, hydrophilic inside substance. Robson actually did this, but this arrangement was with solvent inside. So it wasn't possible to put something there. But when he was removing the solvent, all of this collapsed. So actually the Yakhi work was the first one when they obtained these crystal materials with these cavities, and expectation was very big because we can construct this with shape and chemical characters. So application are huge. And we can compare this to the wardrobe with shelves because these cavities are of course shelf, but chemical characters define how some gases can without any energy absorb in this space. So we are saving the space. So probably it's good for gas storage. But so far, we don't have any solution for gas storage using MOFs. Automotive sector is another promising, especially for hydrogen storage. So far, this hydrogen storage are unsafe, and probably the high pressure doesn't help to that construction is safe, and still this too much space for hydrogen storage. Only one commercial solution is with this mask. I've checked; they cost a few hundred zloty, but they are actively absorb some toxins, nanoparticles, and others. So maybe in Krakow will be useful.
And well, I understand that such a MOF structure can absorb hydrogen, but how to get it hydrogen out of it is
actually it's without an energy. It's normal diffusion. So normal diffusion. So assumption is that they can be easily put like on the shelf, so it doesn't require additional energy.
So I understand that let's assume that it is somehow put inside, and you can let's say use it
easily use it. Yes,
having as a kind of a source of.
And of course, in medicine, the promise is also quite big, especially in cancer, because most of the cancer drugs are highly toxic. So delivering to tumor area, not to systemic systemic toxicity is very promising thing. And of course, we can think about this that tumor area has different pH, has different enzymes. So constructing the MOFs which will be degraded inside the tumor area is still a promise, unfortunately. Another use case is destruction of this and releasing the drug exactly where we want is using light. But in general, MOFs are unstable, so we don't see any advantage of using it. And actually, to my research, because researchers still believe that nanomedicine gives us advantage, but so far there is only a one but. So one single example that nanomedicine encapsulating of toxic drug doxorubicin with some lipid layer reduce the toxicity of our body and is less toxic. So there is only one drug approved by FDA. And here's my consideration about which drugs maybe should gain a Nobel Prize, but they never get.
Up to now.
Actually, I think when I think about this more, there is some pattern how to classify this, because we can think about the molecule as the final product. Before this, here presents trastuzumab. This is antibody drug with excellent clinical outcomes, and it changed the oncology, especially for women with aggressive breast cancer. So previously, when diagnosed patient with HER positive, it was poor prognosis, but nowadays prognosis are much better, and actually having this HER positive gives you better clinical outcomes. So few years back it was poor prognosis, but nowadays is quite a standard of care. So many years ago they discovered genes of HER2. Then few years later they discovered receptor on the surface of cancer cells, and finally, subsequently, they discover the antibody trastuzumab. So as I mentioned, it changed the clinical outcome and have a big clinical impact. And here's second one example, and it's even higher impact. Imatinib. This drug was first designed. What do we mean by design? Because here the process was even longer. In 1960, they first have microscope, nothing more. So they look at the chromosomes of patient, and they realize that one chromosome in the sequence are much shorter than others. So they try to connect somehow with this leukemia. 20 years later, in 1980s, they connect this with oncogene, because in 1980s we have some methods. We can extract DNA, we can splice them, extract, and using these matrices, like we expect what it could be, and we expect what it could be by try and error. So it was tedious work, but they discovered that there is some specific gene called Philadelphia chromosome, and this gene makes the protein tyrosine kinase which is the oncoprotein, which produces a signal for survival for cancer cell. So nowadays, although the name of this leukemia is chronic, it wasn't chronic a few years ago. It was really a fatal disease. But nowadays, this is a chronic disease that we can take the imitanib, and usually people much longer. So the reason why these drugs both are not awarded, and even there are some more examples, it is obviously more than three contributors, because as I told you, there are many steps to discover, like 60 years ago, 40 years ago, 20 years ago. So it spans on decades. But maybe in my opinion, the discovery of the genes somehow could show some mechanism, and yeah, as I mentioned, the final molecule is like a product. First, we have to discover what's going on in the body on molecular level, and after 2000, we are able with PCR, so it's quite standard nowadays. So more than three contributors. It's one thing. Another is that it's difficult to attribute the discovery, and also it's not general, because oncogenes are not specific. I mentioned about one oncogene, BCR, ABL, and here another, HER2. So obviously there are many oncogenes. So it's too specific, not general rule for whole biology. But there are some drugs awarded with the Nobel Prize. Maybe the construction for what they achieved was quite different, because penicillin, discovered by Fleming, was awarded for antibiotic principles. So in general, whole group of antibiotic, whole classes of drugs. And in his case, word discovery is a good word, because I mentioned previously design, like we know the target, we work together to really arrange how this molecule will work. And in his case was accident. So it was really discovered. He had some mold in laboratory, and this mold, he realized that kill bacteria, and few years later these two guys helped him to extract this anti-penicillin from this mold, and both get the Nobel Prize. And from 2015, artemisinin is also a medical product, but in general it helps in modern anti-malaria therapy. On the last slide, I will show more about PD-1, PD-L1, because as I remember before COVID, it was the hottest topic, probably. It was after, we cannot see, but it was in 2018. So yeah, after the Nobel Prize awarded, everyone who in proposal had PD-L1 inhibitors, and every paper and presentation poster on, if you have this, it's like 2 years ago having the AI or LLMs. And here's another consideration. Maybe some of you recognize this guy. He's a chemistry Nobel awarded last year, Demis Hassabis, for AlphaFold. But in contrast to his wishful thinking, like, I think one day we may be able to cure all diseases with the help of AI, maybe within the next decade or so. So but in contrast, other people said that there is a famous article in the pipeline, because nowadays every startup company is like a pipeline of AI promises.
Mm-hmm.
And this they said AI in drug discovery is like turbocharger on the windshield wipers. It helps, but definitely it helps not to the process the most important, because the drug selection is hard process, but not crucial. The crucial process is how to translate from in vitro, in vivo activity to the human. So we still have a gap between in vitro studies and even animal studies into the human. So help of AI is big, but not crucial. And the last slide will show that biology is far more complex. So Hassabis, as a Nobel Prize winner, I could agree that maybe someday another AI model will get the Nobel Prize in chemistry. But definitely solving of diseases, in my opinion, isn't possible. And here I will move to the Nobel Prize in medicine. Maybe I should put more slides about what is the regulatory T cells. But in short, our immune system is designed to not attack our cells. So in principle, it should kill bacteria, viruses, parasites, or other or cancer cells, as I showed you. But sometimes, and Tregs, in short, Tregs are like military police for the immune system. So they supervise that immune system will not attack our own cells. So if Tregs in our body is the low level of Tregs, there is a problem, and it could be all of types of diseases like diabetes 1, when autoimmune destruction of pancreatic beta cells, rheumatoid arthritis, Crohn's disease, and multiple sclerosis is also autoimmune disease. So they have a common ground, like this autoimmune response, but so far we don't have any curation of this type of diseases. We only treat the effect of this disease. And here's the Poltrek. Here is the Polish company based in Gdańsk. It's quite fascinating, especially after this Nobel Prize, because the subject now is very famous. But what Poltrek is doing, they isolate the Treg from our body. They expand them ex vivo, so outside our body. They expand the Treg, and then rejecting into the patient, and they observe interesting result with re-emission of the some autoimmune diseases. So the promise is quite big, but you should definitely, and I'm curious about this Polish touch in this area, because we don't have much success in biotech as a Poland. So we will see how it goes with the Poltrek. And here's also interesting example. Anyone is picking mushrooms or interested? Even though everyone should and hopefully should recognize the dead cat mushroom. For me, it's interesting because amatoxin has specific mechanism of action, which is RNA polymerase inhibition. Sounds like the great anti-cancer target, because RNA polymerase produce the protein in our body. So inhibition of it result with the first with the liver failure. So it's a sneaky toxin because usually we have some symptoms. First, we feel bad with nausea, but then brief improvement, so we don't realize that something is off. But typically after a few hours, there is too late for help with this amatoxin. So this is very sneaky. But what if I told you that now amatoxin is used as a drug? Sounds like crazy, but we have this antibody drug conjugates, which is particularly the antibody which attach to cancer cells. There is a linker and payload with this toxic drug. The point is that this kind of arrangement has to be inserted into cancer cells. So not every antibody is let's say eaten by cancer cells, but of course in case of amatoxin is crucial because otherwise this toxin will be very toxic and probably deadly. So it's interesting fact that nowadays Heidelberg Pharma is conducting two research in multiple myeloma and metastatic castration-resistant prostate cancer. Both projects are in the first clinical trials, so obviously I will be looking for how it's go. And of course, in case of amatoxin, they're using this for the most deadly cancer type. And from my research interest, clinical trials with Destiny Breast 03 have a good result with exatecan, and it's so there is nowadays trend, and actually if someone is interested with some biopharm company, they said this is too late because most of these companies have almost the product in this case. So the drugs which were failed in some clinical trials now are again repurposed, but in the arrangement of antibody which make them less toxic outside the normal cell. So it's probably the, who knows, maybe also some solution which will be awarded as a biology problem solved and Nobel Prize. And the last slide, I told you 2018 Nobel Prize in Chemistry. So in general, PD-1 is a receptor on our T cells. T cells are our good cells, which helps to kill inappropriate cells. And PD-L1 receptor is something which turns off the activity of T cells. Sometimes it's good. If our body produces PD-L1, our normal cells tells I'm okay, don't turn me off. But the cancer cells are very smart, and paradoxically, interferon gamma, additional immune cells, which shows our immune system, here is the danger of cancer cell. I send the interferon gamma, and the signal makes more producing PD-L1 on the cancer cells. So as I mentioned one slide, that biology is much more complex. It's not like defining things and waiting that it will be works. But usually after knowing some process or after applying in clinical trials drugs, after many years, we see the result that cancer or other microorganisms outsmart our solution because they also want to survive. So it's a clear example that biology is complex and somehow it's connected with recent year awarded because it was also in immune system, but this year awarded in medicine, but in this case it was the Nobel Prize in chemistry. So I hope you enjoy this short story. And is there any question?
Well, Adam, many thanks for this overview and also some explanation from, let's say, your research area. Yes, we have time for questions from the audience. Well, so if somebody would like to ask a question,
please, Olaf.
Olaf, please go on.
Oh, first, thank you for the interesting talk. I would like first to make two remarks. So, of course, one of the selection criteria for the Nobel Committee very often may be that they still want to give the prize while the Nobel Prize winner is alive. So Robson is 88 years old, so maybe it was due time that they award this Nobel Prize before they, by their own regulations, have difficulties to do that to the right persons. So that may be one of the considerations here for this year's Nobel Prize. The other one, you were mentioning Heidelberg Pharma. I think it's a funny example. So you know that the main investor was Dietmar Hopp, who was an the SAP co-founder. And of course, now a controlling minority of 35% is in China. So that is also something where we Germans have our stories. KUKA on the robotics part, Heidelberg Pharma is another example where all the interesting inventions go and get scaled up somewhere else, but not here in Germany. So were two remarks. And of course, well, it's not unusual, is it, that as far as I know, there's a lot of toxins that are used as kind of medicine in the right concentrations, and if you can target them to the right places, yeah. So that's not unusual. So in principle, penicillin is a toxin. Yeah. So and so of course, yeah, we use it. It's not toxic for us, luckily. Yeah. But there are enough things. You can think of digitalis for heart medication. There are many of those things that many of the drugs we are using in other concentrations would be toxins. Yeah. So it's just how to use them.
Yeah, but the ADC, this antibody drug conjugates, actually diminish the use case of MOFs in medicine. I still remember 10 years ago, MOFs are big promises about the delivery of the drug directly to cancer cells. But now it seems to be maybe not solved, but if we have much better solution, why we still should facing the stability of the MOFs, because
yeah, I would agree that targeting definitely the antibody is more specific. Yeah. On the other hand, MOFs have some other, let's say, benefits. Yeah. For example, slow release is something where you can do that, or they are also used as antitoxins. Yeah, because they really can absorb a lot of things. So I think each of these molecule types have their use cases, don't they?
Well, Olaf, many thanks. Let's look for other people with questions. So in your talk, you had presented some possible candidates for future Nobel Prizes. Well, which mechanism you think is the most promising in such a type of discoveries? Because Nobel Prizes are Nobel Prizes, but I think that construction of new drugs, it is something which probably now requires rethinking somehow.
Yeah, so I mentioned about maybe Polish things like Professor Grzybowski, because a few years ago, who was thinking about that AI model will be awarded with in chemistry. It's AlphaFold, yeah. So if Nobel gave the Nobel Prize for theoretical model, and I think that the impact is one thing, yeah, number of citation and so on, but the big impact. If we have the algorithm which reduce by half or more the reaction step, it gives us any opportunity to be able to produce these molecules. And most pharma companies nowadays are using some transformers. And the result of this model are very hard to get. So at some point we stuck in the point that that's great, we have the model, but what we will do with it? And the answer is this kind of model of retrosynthesis. Retro means that we are getting back in steps and we are trying to optimize all of these steps. And they are clear evidences. So pharma companies first will patented this synthesis optimization. Then we'll patented the drug. And we are actually not sure how many of these discoveries are thanks for this kind of algorithm. So the only reason why I mentioned that maybe someday it will be awarded is that if last year Nobel Prize could be awarded for algorithm, which was very impactful, why this one would not? But regarding the Nobel Prize in chemistry, maybe this antibody drug conjugates seems to be some mechanistic approach which deserve, especially in case of huge application.
Okay, thank you. Well, so if there are no more questions, so Adam, many thanks for your talk, and we will have the last seminar this year in a week from now, and it will not be about Nobel Prizes. It will be about some research conducted by Monica Petlas. We will come back to Nobel Prizes in January. It will be Nobel Prize in Economy. So many thanks, and see you once again in a week from now. Thank you.
Thanks, bye.